What a privilege it is to congratulate my friends and colleagues at Housecall Providers on their 25th anniversary. It is such an honor to be a part of this celebration. Dr. Benneth Houston and I have known each other for 20 years. Led by our faith, Benneth started making house calls way back in 1992, and I began in 1993. The most common house call payment back then was only $60, which was less than an office visit. When Benneth received the Housecall Physician of the Year award in 2004, she said, "What she did not receive in money, she received in appreciation and the intoxicating feeling," I love that, the intoxicating feeling of knowing how much the care truly mattered to those she served. Little did Benneth know how her heart to serve, which is embedded in Housecall Providers, would impact Portland and our country. House calls are such an incredible blessing to our patients. The great majority of house calls are what I call high-touch primary care and palliative care, but we now have the high-tech capability to do the highest quality care in the home. Patients of Housecall Providers can have x-rays, ultrasounds, EKGs, and blood tests done in the comfort of their homes. In fact, Housecall Providers can actually do more diagnostic testing in the home than most primary care offices. In addition to at-home advances in diagnostic technology, we also have therapeutic advances such as home dialysis, smart IV pumps, and home ventilators. Housecall Providers has taken care of several patients on ventilators in the home. House calls thus provide not only exceptional patient-centered, compassionate care, but also the highest quality care you can get. Currently, there are 3 million people in our country that could benefit from home-based primary and palliative care, but only 15% receive it. What would we think if only 15% of cancer, heart failure, or COVID patients were served? Plus, most patients in need of house calls are the elderly with multiple chronic conditions whose numbers are dramatically increasing as our population ages. Those over the age of 85 are the most homebound, and their numbers will quadruple by 2050, substantially increasing the need for home-based primary care. There are also younger homebound patients who suffer from neuromuscular diseases such as multiple sclerosis, muscular dystrophy, traumatic brain injuries, or cervical spine injuries with quadriplegia. The great majority of these patients, young and old, would like to live out their lives in the comfort of their homes. Thankfully, Housecall Providers enables them to do this, as shown by home-based primary care reducing nursing home placement by an astounding 89%. Not only is this what our patients desire, but avoiding nursing homes is also cost-effective for our patients, their families, and for our society. The home is also a much safer place, as COVID has unfortunately shown us. Another remarkable aspect of Housecall Providers is quality end-of-life care. Like most housecall programs that serve the sickest patients in society, 20 to 25% of Housecall Provider patients pass away each year. Over 70% of Americans say they would like to die at home, but only 31% do. Most die suffering in hospitals, hooked up to IVs and machines. Fortunately for those cared for by Housecall Providers, including their wonderful advanced illness program, over 70% pass away at home, surrounded by loved ones, at peace, and supported by all of Housecall Providers' outstanding hospice services that you heard about tonight. The hospice services are not only a blessing to patients, but also to their families. Portland is fortunate to have Housecall Providers, but so is our country. Housecall Providers' vision is to transform healthcare so all homebound patients can receive house calls, not just patients in Portland and not just 15% of those in need in our country. For this to happen, we need to influence our legislators, payment reform, and train the workforce in this new field of home-based primary and palliative care. Housecall Providers has done it all. You have given us our biggest champion on Capitol Hill in Senator Ron Wyden. In addition, Rebecca Ramsey co-chairs our National Legislative Committee. You have also shown Capitol Hill and CMS the value of home-based primary care through your outstanding success in the Independence at Home Medicare demonstration. To give this some context, accountable care organizations are considered a great success of healthcare reform because they reduce costs by 1.2%. In comparison, in the first year of Independence at Home, you reduce costs not by 1.2 or 10 or 20%, but by an unbelievable 32%, making you the most successful Medicare demonstration practice ever. This caught the attention of Washington, D.C., and Independence at Home has subsequently impacted the new payment models starting next year that support home-based primary care. So you gave us Senator Wyden, Rebecca to co-chair our National Legislative Committee, and you showed CMS the value of home-based care that has led to new payment models, and all this has resulted in a marked increase in house calls in our country. Now we need the workforce. And here again, Housecall Providers has had both local and national impact. You have helped train providers locally throughout your history. Plus, both Terry Hobbs and Rebecca Ramsey have trained practices nationally through the Home Center Care Institute, and Rebecca sits on their board helping to expand training nationally. This picture is Rebecca at HCCI training 26 nonprofit hospices on how to start home-based primary and palliative care programs. They voiced immense appreciation of how transparent Rebecca was about Housecall Providers' successes, but also their struggles, and with all the information she shared. What a remarkable impact to help 26 other hospices to create Housecall programs, and you have done so much more. You have helped create the tipping point where Housecall programs are spreading nationally, so more than just 15% can be served. A great example of this is an organization I joined this year called Village MD, who asked me to create Housecall programs in 8 states. In July, Walgreens invested $1 billion in us to create 500 Walgreens-associated primary care clinics in over 30 new markets. I get to create Housecall programs in every one of those markets because you helped show our country the value of house calls. I want to end with a quote from Dr. Martin Luther King, Jr., who said, "If I cannot do great things, I can do small things in a great way." King, of course, did both, as has Housecall Providers. For 25 years, Housecall Providers, as you have seen tonight, has done so many small things for their patients in great ways to give them the highest quality of life and quality end-of-life care. And like King, Housecall Providers has impacted our country by advancing care into the home to transform our healthcare system. You are truly an inspiration. Thanks to everyone at Housecall Providers for your outstanding care. Thank you to all the former board members and all the supporters of Housecall Providers who have enabled them to do such remarkable work over the past 25 years. I know how hard this work is and how powerful it is to make such a difference in people's lives. I ask that you continue to support this amazing organization so they can have even more impact over the next 25 years. Thank you.